Thank you. So today's topic of our class is basically a continuation of a subject that we are covering in our previous classes as well. And the topic that we are covering in our previous classes is chronic disease prevention. And today is part three, prevention and management of ischemic heart diseases. And as we already know, we have covered diabetes mellitus, we have covered hypertension management. So now today we are going to cover this disease that is ischemic heart disease. Ischemic heart disease is also called coronary heart disease as well, because ischemia of blood vessels of the heart, occlusion of blood vessels of the heart causes ischemia of the heart muscles, and these ischemic changes then present the symptoms with which the patient comes to our clinic. As you already know me, I'm Dr. Omer Farooq Khan. I'm a resident surgeon doing my residency in orthopedic surgery in Benazir Bhutto Hospital, Rawalpindi Medical University, Pakistan. So, learning objectives for today's class are, as we already know, we introduce the topic, then we discuss some basic definitions, and the definitions we cover are helpful for understanding of the terminologies which we used in our class. Then brief summary of previous class, as this is a lecture series and not an isolated case. So we always summarize what we discussed in our previous classes as well, so that there is a understanding, there's a better understanding of all of the lectures in this lecture series. Then we are going to come to our today's topic, that is epidemiology of ischemic heart diseases, then types of ischemic heart diseases, then pathophysiology and clinical signs, symptoms of ischemic heart diseases, then how to approach a patient with ischemic heart disease, that we will discuss, that how are you gonna approach any patient who is suffering from ischemic heart disease. How will you take history? How will you examine? How will you diagnose a patient with ischemic heart disease? What diagnostic modalities you will use and diagnosing a patient with ischemic heart disease, and finally management strategies for ischemic heart disease. So these are the things with which we are going to discuss today. I always try my best to keep my class short, but as these topics are so vast, these topics are so rich with material, and these topics are so huge that somehow I end up with a little bit more slides that I intend to add. Anyways, we are gonna start with introduction. So ischemic heart disease or coronary heart disease. So I will use these terms interchangeably in our entire class, so that you people understand this is same side of the story. For example, if I say coronary heart disease, it means ischemic heart disease, because ischemia is due to the disease of coronary blood vessels. So coronary blood vessels, if they get diseased, they cause coronary heart disease, and that disease is also resulting in ischemia. So that is why it is called ischemic heart disease in some literature books, and in some textbooks of medicine they call it coronary heart disease, but they are used interchangeably and they essentially mean the same thing. Ischemic heart disease or coronary heart disease is heart damage caused by narrowed heart arteries. This is also called coronary artery disease and coronary heart disease. When arteries narrow, less blood and oxygen reach the heart muscle. This can also lead to heart attack. Coronary heart disease is the leading cause of death in the United States for men and women. Coronary heart disease is caused by the buildup of plaque in the arteries to your heart. This may also be called hardening of the arteries or atherosclerosis. In the United States alone, heart disease is the leading cause of death for men, women, and people of most racial and ethnic groups. One person dies every 33 seconds from cardiovascular disease. So they use the terminology cardiovascular disease. So it's not just heart disease, but stroke, either hemorrhagic or ischemic, or some other problem related to the cardiovascular system. But overall, any cardiovascular disease, you take a handful of cardiovascular diseases, but one person dies every 33 seconds from cardiovascular disease. Coronary heart disease is the most common type of heart disease. It killed 300,000, 371,506 people in 2022. About 1 in 20 adults aged 20 and older have coronary heart disease. That is about 5% of the demographic population. In 2022, about 1 out of every 5 deaths from cardiovascular disease was among adults younger than 65 years old. So the disease is not just targeting the older individuals anymore, but there are many instances where younger people are also dying because of this disease. In the United States, someone has a heart attack every 40 seconds. Now you can imagine that how widespread the ischemic heart disease is due to the current lifestyles, due to the sedentary lifestyles, due to poor dietary habits, due to caffeinated drinks, due to smoking, due to many other factors, heart disease are increasing in their trends, and someone has a heart attack every 40 seconds in the United States. Heart attack means myocardial infarction or cardiac arrest related to the problems with ischemic heart disease. Every year, about 800,000 people in the United States have a heart attack. Of these, 600,000 people are a first time heart attack, and 200,000 people happen to be people who have already had a heart attack previously as well. So, it's quite widespread. About 1 in 5 heart attacks are silent, meaning the damage is done, but the person is not aware of it. So, now we come towards the basic definitions. So, definitions are very important in understanding the basic terminologies, which we will keep using again and again. So, ischemia. What is ischemia? I've used the term ischemic heart disease, but if you don't even know what is ischemia, how will you define a disease and how will you understand a disease? So, ischemia is defined as inadequate blood supply circulation to a local area due to blockage of the blood vessels supplying that area. So, it's basically a generalized term. It's not specific for the heart. Ischemia of any body part can happen anytime. So that is why I will put up a generalized definition here. So ischemia is defined as inadequate blood supply circulation to a local area due to blockage of the blood vessels supplying the area. Ischemic means that an organ, example given the heart or brain, is not getting enough blood and oxygen and nutrients. So any organ, if we say the organ is getting ischemic, it means the organ is not getting enough blood and oxygen, resulting in all those problems that happen to occur due to the problem of less blood supply and less oxygen supply. Angina. What is angina? The discomfort experienced when the heart muscle is deprived of adequate oxygen is called angina pectoris. This is a clinical syndrome characterized by discomfort in the chest, jaw, shoulder, back, or arms that is typically aggravated by exertion or emotional stress and relieved promptly with rest or by taking nitroglycerin. So nitroglycerin is basically arterial dilator. It dilates the blood vessels, so the symptoms of angina settle down. But it is basically a symptom. So angina is the feeling of discomfort experienced when the heart muscle is deprived of adequate oxygen or blood. And this terminology is also called angina pectoris. Basically, it's the chest angina or chest pain or chest heaviness or chest tightness. The feeling of chest tightness is basically angina pectoris. This is a clinical syndrome characterized by discomfort in the chest, jaw, shoulder, back, or arms, especially left arm, that is typically aggravated by exertion or emotional stress and relieved promptly with rest or by taking nitroglycerin. And what is infarction? One thing is ischemia, and the second is infarction. So when the tissue is crying due to lack of blood and oxygen, but the tissue is not dying, that is ischemia. But when the tissue starts dying, now we call it infarction. So cardiac ischemia, myocardial ischemia, is a condition in which the muscles of the heart are crying that we are not getting enough blood, we are not getting enough oxygen due to some plaques in arterial blood supply of the heart, but they're not dead yet. But when the muscles start dying, that is infarction. Infarction can happen anywhere. It can happen in kidneys as well, renal infarction or brain infarction. But right now, as we are covering the topic of heart, so we will talk about myocardial infarction. Myocardium is basically the muscles of the heart which contract and supply the blood to our bodies. So infarction is basically death of tissue resulting from a failure of blood supply, commonly due to obstruction of a blood vessel by a blood clot or narrowing of the blood vessel channel. The dead tissue is called an infarct. I hope you got the message. And what is atherosclerosis? Atherosclerosis is buildup of fats, cholesterol, and other substances in and on the artery walls. So, in the artery walls and on the artery walls, bulging inside into the lumen of the artery as well. This blood buildup is called plaque. The plaque can cause arteries to narrow, blocking blood flow. The plaque also can burst, leading to a blood clot. Although atherosclerosis is often considered a heart condition, it can affect arteries anywhere in the body. So it's not a condition related with heart blood vessels only. Atherosclerosis can happen anywhere in the body. It can happen in your leg blood vessels, it can happen in your brain, it can happen in your lungs, it can happen anywhere. But most commonly, as we see people with ischemic heart disease or with heart disease, that is why atherosclerosis inadvertently gets linked up with only the heart muscles or the problem with the coronary blood vessels, but it's a generalized problem. It can happen in any blood vessels of the body. And arteriosclerosis happens when the blood vessels that carry oxygen and nutrients from the heart to the rest of the body become thick and stiff. So atherosclerosis is basically buildup of fats, cholesterol, and other substances in and on the artery wall. So basically, buildup of fat or cholesterol plaques is atherosclerosis. Atheroma formation. Atheroma is a plaque of some unwanted material in the lumen of the blood vessel. That is atheroma. So that is why the term atherosclerosis. And arteriosclerosis means the muscular elastic walls of the arteries of the body have sclerosed, have fibrosed. They are not that much muscular now. They are not that much elastic now. They are thickened. They are fibrosed. So basically, even in if some of you are in active clinical practice, sometimes an old age person comes to your clinic or comes to your clinical setting and you palpate their radial pulse or brachial pulse and you feel that their artery lines and their arteries are thickened. They're not that much fluffy, they're not that much rubbery, but they feel like hard, leathery in texture. That is arteriosclerosis of old age. So arteriosclerosis happens when the blood vessels that carry oxygen and nutrients from the heart to the rest of the body become thick and stiff. These blood vessels are called arteries. Healthy arteries are flexible and elastic, but over time, the walls in the arteries can harden, just like I have told you. I hope you understood all of the basic definitions. These definitions are always important to remember when you are trying to understand the topic of ischemic heart disease. So, brief summary of previous class. As we already know, we covered diabetes in our first class and we discussed hypertension in our second class, and now we are discussing ischemic heart disease in our third class. So epidemiology of hypertension was understood in previous class. We discussed types of hypertension, we discussed pathophysiology and clinical signs symptoms of hypertension, and we discussed how to approach a patient with hypertension, then how to diagnose, and finally management strategies of hypertension were discussed in our previous class. So today's topic is ischemic heart disease. That is why we will start understanding today's topic without wasting even a single minute. So in this section, we will discuss all the brief clinical details regarding the basic understanding of ischemic heart disease or coronary heart disease, IHD or CHD. Epidemiology of ischemic heart disease. So we hop towards the UK. There are 2.3 million people in the UK living with chronic coronary heart disease, about 1.5 million men and 800,000 women. And it is estimated that about around 1.4 million people alive in the UK today have survived a myocardial infarction, about 1 million men and 380,000 women. And mortality rates, coronary heart disease is the most common cause of death and premature death in the UK. Now you can imagine. No accidents, no other disease, just simple preventable disease of heart. Yes, coronary heart disease is a preventable disease. So, coronary heart disease is the most common cause of death and premature death in the UK. Coronary heart disease is one of the UK's leading causes of death and the most common cause of premature death. It is responsible for about 66,000 deaths in the UK each year. In 2009, coronary heart disease caused 13% of male and 8% of female deaths. Yeah, all of the heart diseases are common in men. All of the heart diseases are more in men than women. That is why more men die of heart diseases than women. It was the leading cause of death worldwide in 2019. Now imagine, it was the leading cause of death worldwide in 2019. In the UK alone, 1 in 8 men and 1 in 14 women die from coronary heart disease each year. About 25,000 people under the age of 75 in the UK die from coronary heart disease each year. Coronary heart disease kills more than 25 twice as many women in the UK as breast cancer. Now imagine, even coronary heart disease is even more deadlier than breast cancer and kills more women prematurely before their 75th birthday just because they have a diseased heart. CHD death rates are highest in Scotland and north of England. In the UK, as many as 100,000 hospital admissions each year are due to myocardial infarction. In the 1960s, more than 7 out of 10 myocardial infarctions in UK were fatal. Today, at least 7 out of 10 people survive. So basically, one thing that is good is the management protocols have smoothened, the management strategies have gotten better, the management the managing hospitals have gotten better. That is why the mortality rate related with myocardial infarction, so myocardial infarction is basically a heart attack in lame term. So it is a heart attack when your heart starts dying due to lack of blood supply and lack of oxygen. That is myocardial infarction, and that is what we call a heart attack. Today, at least 7 out of 10 people survive. Although mortality from chronic heart disease is falling, morbidity appears to be rising because more number of people are contracting this disease each year. The number of people contracting the disease of ischemic heart disease is increasing. Although the mortality has decreased due to better management, better outcomes, better management strategies worldwide, but morbidity is increasing. British Heart Foundation estimates that in 2016, 2.3 million people in the UK were living with the diagnosis of CHD, and around 1.1 million people have survived MI. We already discussed that. Data from UK clinical practice research data linked to 2012 and estimated that 3% of men and 1.7% of women experience angina, with incidence rising with the increasing age in both sexes. So, what is classification of heart pain? We need to understand what is classification of angina pectoris or ischemic heart pain in order to understand the severity of the illness. According to most recent guidelines by the Canadian Cardiovascular Society, classes of angina are as following. Class 1. No limitation of ordinary activity. Angina occurs with sternness, rapid or prolonged exertion at work or recreation. So basically, patient is apparently healthy. But if a patient has to walk briskly, or if a patient has to do some jogging or do some running or play some game, and after 5 or 10 minutes of playing or running, patient starts having pain. Angina may occur with chopping wood, climbing hills, cycling, aerobic ballet, ballroom fast, or scare dancing, jogging, or 10-minute mile, rope skipping, skating, skiing, playing tennis or football, or walking 5 miles per hour for longer periods. So basically, that is class 1 angina. Patient is otherwise okay in normal routine, rest, rumination, sedentary lifestyle, nothing is happening. But if the patient has to do any kind of exertion, patient starts having pain, especially after 5 to 10 minutes of exertion. And class 2 is a slight limitation of ordinary activities as well. So class 1 is basically no ordinary activity pain. Class 2 is slight limitation of ordinary activity as well. Angina may occur with simply walking or climbing stairs, walking uphill, walking or climbing stairs after meals, in cold or in wind, under emotional stress, only during the first few hours after awakening, or with walking more than 2 blocks on level ground and climbing more than one flight of ordinary stairs at a normal pace and in normal conditions. So patient starts having pain, that is angina. With normal routine activities, climbing a hill, walking, not running, just climbing a hill or climbing stairs rapidly, or walking and climbing stairs after meals, or in cold or in wind, or even slight emotional stress starts the painful stimulus of heart pain. So that is class 2 angina. Marked limitation of ordinary physical activity, angina may occur with walking 1 or 2 blocks on level ground, climbing one flight of stairs in normal conditions and not at rapid pace. Playing a musical instrument causes chest pain. Performing simple household chores causing chest pain. Patient is unable to do gardening without pain. Patient is unable to do vacuuming. Patient is unable to walk his or her dog or taking out the trash. So see, these trivial activities become painful for a patient who, and if these activities become painful for the patient, that is class 3 angina. So basically, you need to understand that the more the class increases, the class goes towards 4 or 5, the more the risk of death increases. And what is class 4? Class 4 angina is the most severe form of angina, where is inability to perform any physical activity without discomfort. And angina may occur at rest as well. So when the blood vessels is so stenosed and the plague has almost occluded the lumen of the blood vessels by 80% or up to 90%, then the problems start to happen. And the patient is labeled as class 4 angina because they are even unable to go to bathroom. They are unable to do walking within the room. Even if they are at rest, they start having chest pain, and that is a dreadful condition. They may die of a heart attack at any time. Any given time, they may die. So, what are types of coronary heart disease, or what is classification of coronary heart diseases? So basically, there are 4 types, most common 4 types, and there are some other very rare types as well, but we will discuss more common and most common 4 types. And these are: number 1 is stable angina, number 2 is unstable angina, number 3 is non-ST elevation myocardial infarction, in which some of the muscles of the heart are already dead as well. And then there is ST elevation MI, in which means that there is a larger portion of the heart which has died, and there are evident ECG changes as well. So basically, I cannot go into doctoral details of how the ECG changes occur and how to pick a myocardial infarction or ischemic heart disease on ECG, because that will open the floodgates of unnecessary given information, because that is a little bit higher level studies, as if you are specifically studying cardiology, or you are specifically trying to understand the subject of ECG, then we can go into such details. But right now, as we have to cover broadly, that is why I cannot go into the details of how ECG changes occur and how and when to spot, you know, but basic information will be given. So stable angina is stable atheromatous plaque which narrows the lumen of the heart vessel. So basically, at rest, patient is okay, but with strenuous physical activity, with some sort of exercise, with some sort of emotional distress, yeah, I have to tell you that emotional distress causes vasospasm of the blood vessels. The blood vessels contract. The blood vessels get narrow with any kind of emotional distress. So if any kind of blood vessel which is getting narrowed has already an atheromatous plaque inside, the symptoms of angina start not only with exercise but with emotional problem as well. That is why if a patient is having ischemic heart disease, we do not right away break bad news to them, because they may cause bad news may cause immediate vasospasm of the blood vessels of that patient, and patient may end up in myocardial infarction or a full-blown heart attack just because we broke the bad news to that patient without preparing that patient properly. So, so basically, there are some markers called troponin T levels or creatinine kinase level. So creatine kinase level or troponin T levels are raised in myocardial infarction, but they are not raised in stable or unstable angina. There are some ECG changes. I will go broadly. There are ST segment depressions in myocardial ischemia, but ST segment elevation may occur in myocardial infarction. So basically, if a patient with stable or unstable angina, you come across a patient with stable or unstable angina, you need to refer them to a cardiologist, and you need to make them understand that the condition may end up in a heart attack and eventually death. That is why they need to get themselves treated. And then there is non-ST elevation MI, which is difficult to pick, and you need proper clinical experience and picking non-ST elevation MI, because many of the time the ECG changes are not that much evident. ECG changes only show some segments depression, but there is no ST elevation in ECG, so it is difficult to pick such changes. But basically, I cannot go into the further details because it will be much more difficult for you to understand. It is not a basic topic, it is a specialized topic, and only cardiologists or medical specialists or the person who are practicing internal medicine, those people are supposed to go into the extra lengthy details of such topics. But I have added this back to basics slide, and if someone wants to go into the details, they can get into the details even by completing this table. So it will give you a basic understanding of all the diseases related with the angina and when to call it infarction. So pathophysiology of ischemic heart disease. So there are some changes that are occurring in blood vessels of the heart. Number one is atherosclerosis. Number two is coronary artery spasm. Number three is thrombosis. And number four is impaired oxygen delivery. So atherosclerosis is formation of plaques within coronary artery disease. These plaques consist of cholesterol, fatty deposits, calcium, and cellular debris. Over time, the plaques can narrow the arteries, reducing blood flow to the heart muscle. Then there is coronary artery spasm. In some cases, the coronary arteries can undergo spasm. They get narrow and the blood supply decrease, leading to a temporary reduction in blood flow. This can occur in individuals with or without significant atherosclerosis as well. So it is one more pathophysiology related with ischemic heart disease, and then the other is thrombosis. Atherosclerotic plaques can rupture, leading to formation of blood clots, thrombi at the site of plaques. These clots can further narrow or completely occlude the coronary artery, leading to a sudden reduction or cessation of blood flow to the heart muscle. So, if there is sudden reduction, then there is worsening of ischemia symptoms, worsening of angina symptoms. But if there is cessation of blood flow to the heart muscle, that is infarction. Then there is one more mechanism, that is impaired oxygen delivery. Reduced blood flow to the heart or muscles results in decreased oxygen delivery, leading to myocardial ischemia. This can manifest as angina or in severe cases myocardial infarction if the blood flow is severely compromised for an extended period. So this is basically an infographic diagram. So, coronary ischemia can occur with obstruction of coronary artery. That is more than 50% of lumen is obstructed due to a plaque formation. Then we call obstructive coronary artery disease. But if there is ischemia but no obstruction of coronary artery disease, such as the plaque is less than 50% of the lumen, then that is called ischemia and non-obstructive coronary artery disease. But still, the patient may get angina when they start having an exercise or strenuous activity, and they are undergoing an emotionally distressed period. Then, even with no obstruction of coronary artery disease, they may suffer from ischemic changes. Then plaque rupture and erosion can also occur, and the plaques which are already present in the blood vessels, they get ruptured and they get eroded, and this erosion then causes the platelet plug to form, and there is a red thrombus formation, which is not cholesterol thrombus, but blood contents are getting stuck to the ruptured plaque. And the younger age, woman, and smoking and diabetes are the risk factor for it. And what is coronary microvascular dysfunction? So, a significant cause of ischemia and no non-obstructive coronary artery disease is also coronary microvascular dysfunction disease as well, in which there are thickened media, intima, and medial walls of the arteries. So arteries lumen gets narrow down just because there are the thickened walls. So normally the wall should not be that much thick, but in some cases the arteries wall is this much thick that the patient starts feeling pain due to lack of blood supply, just because the artery has thickened to the extent that its lumen is getting blocked. And then there is another mechanism, we have already discussed that mechanism, and that is vasospasm. And vasospasm can occur due to many problems, but one of the most common cause is emotional distress. So, what are the risk factors for ischemic and coronary heart disease? So, basically, risk factors of ischemic and coronary heart disease are somewhat related to the risk factors for hypertension and related to the risk factor for diabetes mellitus. So, the risk for developing ischemic heart disease increases with age, and the gender risk is there for men. Men are generally at higher risk. That is why men die of heart diseases way more than women. And after menopause, women's risk approaches that of men, but before menopause, men are more prone to die of heart diseases, even before 50 years of age. Then family history is very important. Having a close relative with a history of heart disease um, increases the risk for the other family members as well. Then some modifiable risk factors are there, because age is not a modifiable factor, gender is not a modifiable factor, family history you can't change. So these are non-modifiable risk factors, but then there are some modifiable risk factors as well, which are greater in number. So high blood pressure, hypertension is a modifiable risk factor. You can control your hypertension, because hypertension eventually causes heart diseases. And high cholesterol levels. You can control your cholesterol levels with eating healthy diets, with eating non-fatty foods, with eating less and less uh, sugary substances, with eating less and less junk food or chips and fries and fried chicken. And so these things, if you start avoiding all kind of fatty foods and fried foods and excessive sugars, then your cholesterol levels go down. And some other modifiable risk factors are smoking. If you are smoking, you are damaging your blood vessels, including the blood vessels of your heart. Diabetes is another very strong risk factor. Obesity and physical inactivity is another very strong risk factor. If you are obese, if you are overweight, and you are physically inactive, then there is also a problem. If you are having a routinely unhealthy diet, so consuming a diet high in saturated fats, trans fats, and cholesterol can contribute to the development of atherosclerosis and heart disease. And one more important thing is excessive alcohol consumption. So excessive alcohol consumption also causes liver damage, fatty liver, and it also damages your heart. So basically, excessive alcohol consumption damages your liver and damages your heart as well. So, what are the signs and symptoms of ischemic heart disease? Chest pain or discomfort is the foremost and most important sign of ischemic heart disease. So, most of the times, patient comes to you with the complaint of chest pain or discomfort or the feeling of tightness of your chest, as if someone is compressing their chest. That is the feeling. Pain can be described as pressure, tightness, heaviness, burning, or squeezing or crushing sensation. Located typically in the central chest or epigastrium, it may radiate to the arms, especially the left arm, shoulder, neck, jaw, or back. So the pain can go anywhere. And radiation of chest pain into the jaw or teeth, shoulder, arm, or back happens. And patient comes to you with the pain of the chest that is radiating to their jaw or teeth, and they are unable to understand what is happening with them. Then there are some respiratory complaints as well. Patients sometimes start getting shortness of breath, dyspnea, tachypnea, and crackles if MI causes pulmonary congestion as well. Pulmonary edema may be present in some patients as well. And then there are some of the times there are gastrointestinal symptoms as well, but these symptoms are not present in class 1 or class 2 angina, but they start getting to appear in class 3 or class 4 angina. Now I will discuss only the classes of angina, because we have discussed in detail what are the classes of angina. So I will just keep mentioning the class of angina, and you people should know what is class 2 or class 3 angina. And genitourinary symptoms as well. Decreased urinary output may indicate cardiogenic shock as well. And then there are skin changes as well: cool, clammy, diaphoretic, and pale skin. Diaphoresis means excessive sweating. So diaphoretic and pale skin due to sympathetic stimulation from loss of heart contractility can happen. And there are some neurological manifestations as well, such as anxiety, restlessness, altered speech, headache, visual disturbance, altered motor function, and confusion. So, when a patient comes to you with all of these symptoms, the symptoms that we have discussed: chest pain, respiratory complaints, skin complaints, neurological manifestations, what do? You immediately take history, ask questions. The healthcare provider will ask about all the symptoms as described above, risk factor details, any family history of heart disease, symptoms of chest pain, shortness of breath, and fatigue are more important indicators. And after you take brief history, then you go towards the examination. So the physical examination of the person is done. This may include checking vitals, listening to the heart and lungs, and looking for signs of heart disease such as swelling in the legs or abnormal heart sounds. So first of all, there is a general physical examination. In general examination, patient's general status is checked: whether the patient is stable or unstable, whether the patient is in pain or not in pain, whether there are any kind of vital signs that are deranged or not. So the vitals of the patient are checked, including pulse rate, respiratory rate, heart, blood pressure, and whether the patient is getting breathless or not. Then we check the patient's weight. We also check the patient's skin appearance as well. Then there is systemic examination related with the heart, and that is BP, pulse rate, and whether there is jugular venous pulse which is raised or not. Then we start auscultating the chest. Apex beat, we start to look at the apex beat, whether it is deviated or not. Then crepitations in the chest, broad sounds. Then we auscultate the heart, and auscultation of the heart means hearing the sounds of the heart. So first and second heart sounds are there or not, whether there is some gallop rhythm. So gallop rhythm is present in heart failure, and whether there is any kind of friction rub, and if there is any kind of tenderness in the abdomen or guarding present. We also look at the body habitus, including weight and height, whether the patient is morbidly obese or not. We also check the waist circumference to diagnose metabolic syndrome and type 2 diabetes mellitus risk, measurement of the pulse and BP as we have already discussed, and then examination of the heart sounds. And we look at some of the signs which distinguish cardiac from non-cardiac chest pains. You people can read them later on. There are some differences in the vital signs. There are some differences in the palpation of chest wall, and complete cardiac examination is done to understand whether the pain is coming from, whether the symptoms of the patient are due to cardiac problems or due to some other problem. And if upon clinical examination and clinical judgment, you make a diagnosis of ischemic heart disease, a provisional diagnosis of ischemic heart disease, and you need to confirm it, what will you do? So you will start running lab workup. You will immediately order the ECG of the patient, and if ECG changes, if ECG does not show any kind of ischemic changes, but you are still doubtful that the patient is having ischemic heart pain and it's not due to some other problem, then you can order stress testing. These tests are used to assess how the heart responds to exertion. They can be done through an exercise stress test or pharmacological stress test as well. So exercise stress test, as shown in the infographic diagram, patient is sitting on a bicycle and asked and ordered to do physical activity. And as soon as the patient starts running the bicycle, uh, the patient starts experiencing chest pain, and then their ECG is ordered. Right at the symptoms of the patient, the ECG does not come normal. If the ECG is abnormal, it means the patient is having chest pain due to heart problem. The aim is to detect any abnormalities in the heart blood flow during physical activity, and the ECG tells that. And if ECG is showing there is some kind of ischemic changes, then you can order an echocardiogram. This is basically an ultrasound of the heart. It uses ultrasonic devices which perform the ultrasound of the heart. This test uses sound waves to create a moving picture of the heart. It can show areas of the heart that aren't contracting normally due to poor blood flow, as well as evaluate the heart valves and overall pump function of the heart. Then, if ECG and echo do tell that there is a problem, then we can order some blood tests, and these blood tests are usually cardiac enzymes, troponin T, troponin I, creatine kinase, MB. So these are troponin, these trops, we call them trops in our medical practice. So these troponin levels are basically cardiac enzymes, and they are raised, and if they are raised, it means the cardiac muscles are getting damaged because they are present in the cardiac muscles, and if cardiac muscles start dying, then these troponin enzymes, troponin levels, these troponin molecules start excreting into the bloodstream from the dying cells, and they increase, their serum levels increase. Then we can also perform coronary angiography, which is done at specialized cardiac care centers. So this invasive procedure involves injecting a contrast dye into the coronary arteries, taking X-ray images to visualize any blockages or narrowing in the arteries. And if there is a problem encountered, and you want to create a picture of the heart, that where the problem lies, so that you can do stenting of the blood vessels, etc., you can order cardiac CT scan or cardiac MRI as well. So there is an algorithm. So if a patient is able to exercise adequately and no contraindications, then you make the patient do exercise, and they start doing exercise. And if after exercise the ECG become abnormal, that is ST depression, ST segment depression, or left ventricular hypertrophy, then to look whether there is any kind of left bundle branch block or not, or if there is any kind of ventricular placed rhythm or not. If there is a bundle branch block, so bundle branch block means the block in the contractility of one side of the heart, whether it is left or right. That is why we call it LBBB or RBBB. So if there is such problem, then you right away order echocardiography of the heart, so that so that the cardiologist performs an echocardiography and tells you whether the heart is contracting properly, whether the heart is functioning properly or not. And if the patient is unable to do exercise, you can also perform myocardial perfusion imaging as well, or dobutamine, or vasodilator echocardiography as well. And you can also perform cardiac computed tomography, tomographic angiography. So basically it is CT angiography. And you can also perform CT angiography as well, in order to understand which of the blood vessel of the heart is narrowed due to plaque formation, as shown in the image on the right side. So if you have diagnosed a patient after all these investigations and clinical suspicion, if you have diagnosed a patient as is suffering from ischemic heart disease, what will you do? First of all, you will ask the patient to change their lifestyle. That is first and foremost step of management of coronary heart disease. You ask the patient, for God's sake, change your lifestyle. And what are healthy lifestyle habits? Stop eating junk foods, stop eating processed foods, stop eating too much sugar, stop eating too much salt, stop eating too much fatty foods, stop eating too much fried foods, and start doing regular exercise. Stop smoking, stop alcohol, and reduce stress in their life. So these are the lifestyle modifications, the one I have written and the one I didn't write, but I know all of these. That is why I told you. First and foremost step in these preventable diseases, whether it's hypertension, whether it's diabetes, whether it is heart disease, it's lifestyle modifications. And then you go towards medications. If a patient is having stable angina or class 1 angina, the patient may not even need any kind of medications, and they may reverse the changes with just lifestyle modifications. But if there is worsening situation and patient is going towards class 2 or class 3 angina, then they may die anytime. So you need to start medications. So first of all, antiplatelet agents such as aspirin or clopidogrel are used to prevent blood clots from forming in the coronary artery disease. Then cholesterol lowering medications are started, which are statins, and these are commonly prescribed to lower cholesterol levels and reduce the risk of atherosclerosis progression. So basically the plaques which contain too much cholesterol particles, these plaques start to disappear with lifestyle modifications and with all of these medications. The nitroglycerin is given. So basically, nitroglycerin is a dilating agent. It dilates the blood vessels all across our body, especially heart blood vessels as well. And then beta blockers. Beta blockers are the medications that can help reduce the heart's workload and decrease the risk of future heart attacks. So beta blockers basically do not let our heart go out of control in increasing heart rate. For example, if our heart is beating at 110 beats per minute, and then the heart is working too hard, and if we start a beta blocker, then the heart rate goes down to 70 or 80, and the patient starts feeling better. And management of coronary heart disease, there are pharmacological medications such as these medications that I have discussed. Then there is our revascularization procedures as well, angioplasty and stenting. This minimally invasive procedure involves widening narrowed or blocked coronary arteries using a balloon tip catheter and placing a stent to keep the artery open. Then coronary artery bypass grafting is an open bypass surgery, open heart surgery. So in more severe cases where angioplasty or stenting cannot be done, bypass surgery may be recommended to create new routes for blood flow to the heart muscle, bypassing blocked arteries. And then there is cardiac rehabilitation program as well. This structured program involves exercise training, education on heart healthy living, and counseling aimed at improving overall cardiovascular health. And then there are implantable devices as well. such as cardioverter, defibrillator, implantable cardioverter, defibrillator. This device monitors heart rhythm and can deliver a shock to restore normal heart rhythm if a life-threatening arrhythmia occurs. And then there are cardiac pacemakers as well. For those people whose hearts are unable to kickstart on their own and are having heart blocks or abnormal heart rhythms, electrical impulses to the heart to maintain a stable heart rate and heart rhythm are done with these cardiac pacemakers. So various advancements in interventional cardiology have occurred in previous 1 or 2 decades. So there are some methodologies, there are some advancements which basically increase the chances of opening of the heart vessel which has been stenosed or which has been obliterated, which lumen has been obliterated with the atheromatous plaques. So these are some of the modalities which are being done these days. So calcifications are being removed, and percutaneous coronary interventions are being done, such as angioplasties or stenting. So what is stenting? Stenting means that you place a metallic or plastic stent in the blood vessel at the point of maximum narrowing so that blood flow to the distal parts of the heart becomes normal again. So there are some intravascular imaging techniques as well, and these imaging techniques and then these stents keep the blood vessel open. Then there are some multivascular surgeries as well, and there are some bifurcational problems, and or these bifurcation problems. Some of the time, computational modeling and simulations are done, and lesions are classified, and treatments are created in a better way. So prevention strategies for ischemic heart disease, as we already know, there are some risk factors, and one of the most important risk factor is high cholesterol levels, obesity, diabetes mellitus, high blood pressure, smoking, sedentary lifestyle, unhealthy body weight, unhealthy diet, excessive alcoholism. So if we stop these preventions, which are primordial preventions, and then primary preventions, and then secondary and tertiary preventions, then heart diseases can be decreased in our families. Heart diseases can be controlled, and the risk of myocardial infarction secondary to heart disease can be decreased with healthy lifestyle. And then if your heart is healthy, you're optimally healthy. So you have to increase your physical activity. You have to manage your chronic conditions such as high blood pressure, high cholesterol, or high blood sugar levels. You have to eat healthy diets. You have to stop all the junk foods and fried foods and sugary foods and caffeinated drinks and etc. etc. You have to get a good night's sleep. You have to uh, schedule regular checkups. You have to reduce alcohol in your life, and you have to decrease smoking. That is how you can keep your heart healthy. Have a nice day. Thank you. Any questions, please?
Thank you, Dr. Omer. We can allow 10 minutes of questions since we ran out of time. So if you have any questions, you can use the hand reaction or leave a comment in the chat. So let's see.
Okay. Uh, okay, I'm going to read the chat. I have already shared this topic with the administration. They will share with you within a day or two. So, how does the incidence of ischemic heart disease vary across different age groups and populations? So, basically, it's a Western disease. Most of the Western countries are suffering from this disease, but this disease is increasing in developing world and underdeveloped countries as well. Why? Due to sedentary lifestyles, due to westernized diets. What are the current trends in the prevalence of ischemic heart disease worldwide? So current trends, as we have already told, they are increasing. So the ischemic heart disease, just like diabetes mellitus, just like hypertension, just like all other metabolic diseases, ischemic heart disease is on the rise. It's not going down, it's going up. And the reason is our lifestyles, our dietary habits, our poor choices. So basically, we are getting more and more less active. We are eating more and more junk foods. We are eating more and more sugary substances and sugary drinks as well. We are using more and more caffeinated drinks. We are using more and more alcohol all across the world, and smoking is there. Many other problems related with our lifestyles are there. That is why the prevalence of the heart disease is increasing. I try my best to deliver you what is important, because these topics are very vast topics. There are tons of books. There are hundreds of books written on these topics, and still people are researching and writing more and more books. So if we start going into the doctoral details or post graduation level details, we cannot even end our topic in 3 or 4 classes. So basically what I try to do is I try to deliver it in the most easiest and the most clinically relevant way, so that you people understand the ABC of the disease, and at the same time you people start to know how to prevent, at least not to treat, because you people are not doctors, but at least the prevention should be known to everyone. So that is why I focus more on the prevention aspect rather than treatment, because I'm not teaching doctors here. So I'm teaching undergraduate or graduate level students. So that is why I focus more and more on prevention strategies. And I always try to keep my jargon less medical and more layman jargon, so that you people understand. And that is why I'll always start with the definitions. I always start my class with the definitions, because if you do not know the basic terms, how can you understand the repeated terms in the whole of my class? So I have to read some of more questions. Why is the rate of ischemic heart disease very high in men than in women in some countries? Very good question from David Nimeri, Charles. So basically, it's due to the stress of lifetime. So, men are more prone to financial stressors. Men are more prone to violence. Men are more prone to um some emotional problems. Their hearts are more prone to emotional problems. Basically, they cannot endure the emotional trauma or the uh, uh, you can say, if they start if they start eating unhealthy diets, or if they are having unhealthy lifestyles, their hearts are more prone to get damaged than women. There is tenacity in the heart muscles of the woman that is not present in men's heart. Basically, that is the reason. uh, okay, any other question? I'm reading the comments first, and then I will go towards the raised hands as well. Dr. Omar, do you have some information about intermittent fasting? Can it reduce ischemic heart disease? So that is the only comment. And then I will go towards the raised hands. Yeah, intermittent fasting helps in metabolic syndrome. So there is no direct problem. There is no direct benefit with the intermittent fasting. But yes, intermittent fasting controls your sugar levels. Intermittent fasting controls your blood pressure problems. So, intermittent fasting controls your cholesterol levels. Intermittent fasting controls your overall emotional well being, and your obesity starts to go down with intermittent fasting. So, when all of these problems start vanishing from your life, obviously your heart will benefit from it. So intermittent fasting does decrease ischemic heart disease risk by correcting your metabolic problems. So now we go towards the raised hands. Ma'am, please unmute them stepwise.
Yes, we can answer these four raised hands and we can go. So let's see what Abdullah Aziz has to say first.
Unmute your mic, Abdullah Aziz. Please, we are short of time.
How are you?
I'm unable to hear you, Abdullah Aziz. I hope you have a stable connection.
Hello. Hello.
We can hear you, Abdullah.
But we are unable to understand what
Maybe,
he's talking about. Yes, we can hear some
yes,
of the words, but we are not able to hear a complete sentence.
you can write your
Uh,
question in the
yes,
chat.
yes.
In the meantime, we can go with another person.
Okay, ma'am. Okay, sure. We can go ahead. He can write his question.
Let's see with Mr. Nduwayesu.
Yeah, Ndoyezu Pascal. I'm calling you from Rwanda. Thank you for the presentation. Are you getting me well? Hello?
Uh,
Are you get are you getting me well?
yeah, yeah, yeah. We are able to hear you.
Yeah, thank you for the presentation. I'm really appreciating doctor for presentation. Since this is all about prevention and management of this disease, heart disease, I would like to ask you, how can we control the junk foods in kids because they like much sugar, and I don't know if this problem also is they are concerned too, because they can be exposed to heart attack and this disease of ischemic heart disease. How can we really prevent them to eat junk foods since they like much sugar, and of course they use it a lot because they move, they learn fast, they use brain when they are studying. How can we control in order to avoid, prevent the disease?
Okay,
Thank
okay,
you.
okay, okay, okay. We are short of time. I have understood your question. I will go ahead and answer you right away. So basically, the problem with the modern world is that the modern world is too much dependent on processed food. But in last 15 or 20 years, the people have started understanding why the people of the far-flung areas with no reach to the processed foods or processed meats or processed butter or processed sugars are living so good, and why the people in cities are having heart attacks day by day. It's just because of not having an organic lifestyle. An organic lifestyle means eating raw vegetables, eating raw fruits, eating healthiest diets possible. So that is a basic problem. You have to cut back on your junks. You have to cut back on your soft drinks. You have to cut down on your sugar intake. You have to cut down on your salt intake. And you have to be physically active. And these problems start vanishing in the society. And if you can't do that, then you can see the society as a whole is getting sick. And the society as a whole is getting sick because of all of these problems, that we are not focusing on prevention. We are ready to take aspirin whole of our life. We are ready to take clopidogrel whole of our life. We are ready to take the statins, which are basically cholesterol lowering drugs, whole of our life. We are ready to get open heart surgery done. We are ready to get angioplasties done. But we are not ready to change our lifestyle. No, we're not ready for it, especially the young people. If someone has already developed heart condition, they are helpless. They have to undergo all these treatments, because if they do not go undergo those treatments, they will eventually die. But what about young people? who are still healthy, who are in their 20s, who are in their 30s, who are in their 40s, who have healthy hearts, but their hearts are getting destroyed by each passing day due to poor lifestyle choices. So, those people need to understand that prevention is so necessary. Prevention is the most important thing in worldwide cutback of incidence and prevalence of these diseases. If we start taking things seriously, if we can control our tongues, the taste of our tongue, if we can control it and we start eating organic diets, much of the problems of this world will vanish. Thank you. Next question, please.
Yes, we can answer the last two questions. From Columbus. Let's see what he has to say.
Thank you very much. I hope I'm audible now.
Yeah, I can hear you in Columbus.
Uh,
Welcome to the question and answer session.
Thank you, doctor. Maybe something that you also need to know, but there are some doctors who are attending your classes, and so when you are talking, we really understand what you are saying. But my question is,
Can
how
can you
much?
please I'm unable to understand. I'm able to hear you, but I'm unable to understand what you're talking about. Can you please get your mic near to your face or something like that?
I'm saying how
Good.
much how much exercise would one do to make sure he prevents these diseases?